Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome to another episode of the Oncology Revolution Podcast. Today's conversation is deeply important for all the healthcare professionals involved in oncological care, because for many years, oncology focused almost exclusively in treating the disease itself. But increasingly and fortunately, we're beginning to ask a much bigger question. How do we help people actually live well during and after cancer? My name is Raquel Maris. I'm an occupational therapist as well as program manager and project coordinator at European School of Lifestyle Oncology. I'm very excited to present today's guest, Dr. Amy Comander. She's a breast oncologist, medical director, and director of the Lifestyle Medicine program at the Mass General Brigham Cancer Institute in Waltham. She is also an instructor at Harvard Medical School, and she has co-founded the PAVING the Path to Wellness program, a lifestyle medicine initiative designed to support breast cancer survivors through evidence-based approaches. She's also co-authored a few books on the same field, which are amazing. And Dr. Amy Comander, it's truly a pleasure to welcome you to the Oncology Revolution podcast. Thank you.
Thank you so much for inviting me. I'm honored to be here.
Let's start off. And before we dive into lifestyle medicine and survivorship care, I'd love to listen to you. Tell me about a little earlier on your journey and what initially drew you into oncology.
Thank you for asking that question. So, when I was in medical school, initially I thought I would go into something related to neuroscience. I was studying neuroscience and really fascinated, and of course I still am. But when I did my rotations in medical school in psychiatry and neurology, while I found them very interesting, somehow it didn't seem like it was the right fit for me. And I realized I loved internal medicine, which is caring for the whole patient and all of the systems of the body. And I loved caring for adults. And I did do an oncology elective in medical school and really found that I developed these strong bonds with my patients in the hospital who were facing these life-threatening diseases. And at that time, I was doing a rotation on the service with patients with leukemia and lymphoma. And it was actually an exciting time for those diseases. There were so many developments, when I was in med school, thinking about how we treat diseases like CML and other types of leukemia. So the science was fascinating. Plus, I loved these bonds I formed with my patients. And so that's sort of what led to me to oncology.
Thank you for your answer. And it's amazing to see that you throughout your career you still maintain these bonds with your patients. I would like to learn more about how you felt passionate about lifestyle medicine and oncology.
Right. So I didn't learn about the field of lifestyle medicine till well after my medical training. So I was already an attending physician at Mass General Cancer Center, seeing patients with breast cancer. And really, one day I just came across a flyer advertising a conference on lifestyle medicine. And I saw that it was being held in Boston and it was on a Friday, so I could kind of get out of clinic and go attend it. And just looking at the agenda, it was really very interesting to me. Some of the topics were how to write an exercise prescription for your patient, the benefits of a plant-based diet for prevention of cardiovascular disease. These topics were just super interesting to me personally, given that I'm a runner and I'm a vegetarian. So for all those reasons, I went to the conference, but was really blown away and felt, wow, this is really important information that I need to bring back to my patients in clinic. And that's really what got me interested in learning more and bringing more of these evidence-based tools to oncology.
It's amazing. And one of the things that's especially interesting about your work is that you're not only speaking about these ideas theoretically, you're actually implementing them and helping to grow this area of lifestyle oncology. I would like to learn more about your role at the Mass General Brigham Cancer Institute and the work you have been doing regarding lifestyle medicine.
Thank you. So, just thinking back to that conference, which I attended many years ago, I met Dr. Beth Frates, who is former president of the American College of Lifestyle Medicine. And I met with her after the conference, and I was really excited to start some type of survivorship program for my patients with breast cancer. And I had all these ideas, honestly, more focused on diet and exercise. And she educated me on that. You don't just focus on that, you really have to think about all six pillars of lifestyle medicine: stress management, sleep, social connections, avoiding risky substances, and of course, the nutrition piece and the exercise piece. So at that time, she was developing a program for stroke survivors called Paving the Path to Wellness, which encompassed all the pillars of lifestyle medicine plus more. How do we set goals? How do we think about our sense of purpose? What is the role of taking a timeout or a break during our week? And we began a collaboration to adapt the paving program specifically for the needs of breast cancer survivors. So that's honestly how that collaboration started, from going to a conference and meeting a wonderful person like Dr. Frady. So I encourage your listeners to go to the conference and connect with the speakers because you may be inspired to start something exciting.
Yeah, well, I think that's amazing. And even the thing that you just said, that's go to the conference and connect and network with people that you find interesting. We are also so eager to do so because actually we just had this month our third conference here in Portugal, held by us also in lifestyle oncology. And we see that this is so much needed, and it's not just needed, people are looking for this. We had a huge multidisciplinary participation, which is amazing, and we touched on all the different topics, and yeah, this is something that we just need to keep on doing. And yes, so thank you for bringing that up. So let's move on to our topic, and we will speak about the paving program in a little bit. Um, so first of all, thank you again for all the work that you have been doing to help bring this more humane and whole person approach into oncology care. And I wanted to speak with you a little bit, as we see that one of the most overlooked moments in oncology happens after treatment ends. So from the outside, people often assume that once chemotherapy, radiation, are finished, like life simply goes on as normal. But it's not like that, right?
For sure. I
So
mean, that,
from
yeah.
no, no, sure, go on.
I was just going to say, that's honestly what got me excited about starting this program. As a breast oncologist, I would treat my patients, right? They have their surgery, often radiation, sometimes chemotherapy, and maybe we're starting them on their anti-estrogen therapies. And sometimes, I'd see a patient at the end of months of chemo and months of intense appointments and say, "You're doing great. We'll see you back in 4 to 6 months." And the person would look back at me with wide eyes and say, 4 to 6 months? Like, what am I supposed to do? Like, what else can I do to improve my health? Dr. Comander, like, what type of diet should I follow? I see all these things on the internet. Like, what should I do? Am I able to exercise? Am I going to get lymphedema? There's all these questions my patients would ask me. And I honestly did my best to address them as a doctor, but also really lacked good resources to help them. Our patients want to optimize their health. Often, I mean, a diagnosis of cancer or heart disease or many other serious things is, I hate to say it, you think of it as like a wake up for people. They want to improve their health. So I wanted to help my patients. So that's what really inspired me to think about survivorship care, as you just stated, and how can we do a better job?
For sure. That's so, so important. And that's exactly as you said, that when they learn that they're only going to be with the doctor, with the caregiver, they're just in a few months they're like, what is going on now, and what can I do for myself? Like they are not able to be with themselves alone. So they face a very different challenge, right? So at the end of active treatment, there is this new challenge for the survivors. And I wanted to know your perspective. So why do you believe survivorship care deserves more attention in oncology today?
Such a great question. And as I think about this question, in the United States, we use the National Cancer Institute's definition of cancer survivor. So I hope I can share it with you because it really shows why this is such an important concept for us to think about in oncology. So and cancer survivorship focuses on the health and well-being of a person with cancer from the time of diagnosis until the end of life. And this includes the physical, mental, emotional, social, and financial effects of cancer that begin at diagnosis and continue through treatment and beyond. And the survivorship experience includes issues related to follow-up care, late effects of treatment, cancer recurrence, second cancers, and quality of life. Family members, friends, and caregivers are also considered part of the survivorship experience. So when you think about that definition, which is very broad and all-encompassing, there are so many aspects to providing, as you stated so beautifully, whole person care for an individual with cancer. It is not just the person in front of you. You're also thinking about their family members, their friends, their caregivers, and you're also thinking about all the things related to their cancer, monitoring for recurrence, looking for a second cancer, but also quality of life and how can we help this person truly thrive after their diagnosis. And so that's why I do think, as you stated already, like survivorship care is so important. The treatment of our patients doesn't just end with that primary treatment of their cancer.
Yeah, for sure. And that's amazing. We should see more of this like worldwide uh, to be implemented, these survivorship centers. It's it's starting. I can see that at least here in Portugal, I can see that it's starting, and there's a lot of good professionals that are actively doing something as you are. But we need more. And emotionally, for the patients, this is a very difficult phase, right? This transition of being taken care all the time and then with constant appointments and then suddenly feeling like they're just expected to move on. This is very difficult, right? So I wanted to learn from you and see your thoughts on this. And why do you think survivors feel more alone after active treatment ends? And how can we help them as professionals to guide them through this phase?
I mean, I think you explained it so beautifully. Our patients are going, I see my own patients, they go through all these very intense treatments, so many appointments. I'll give an example. I think of one of my dear patients. She had a HER2 positive breast cancer, which means her breast cancer expresses this receptor called HER2. So she was getting a year of treatment with a drug called trastuzumab and after her surgery to help prevent recurrence. This is an example from a few years ago. And it's a year. So on the very last day of her treatment, I'm seeing her and I'm like, yay, you're getting your last treatment. I'm sure you're so excited. This is such a big milestone for you. And she actually looked at me and started crying. And she said, coming here every 3 weeks for the past year has just given me this sense of security and I feel safe and I feel like I'm actively doing something every 3 weeks to help reduce the risk of my cancer coming back. And now that it's the last day and I don't come back here for a few months, I won't see you, I won't see my nurse, I won't see that phlebotomist who I love, who draws my blood each time. I feel very lost. And I've heard this from many people, So that was such an interesting wake up early, early in my career for me to realize like, wow, our patients actually really thrive from the support they're getting in the cancer center. And we need to think of strategies to help support them beyond the completion of treatment. So, I think I always say this, we learn the most from our patients. They ask the best questions, right? And that's how we learn about like what the needs are and how we can do better, certainly in the oncology field.
Yeah, for sure. And I would like to know if you have any specific strategies for this long-term um, accompanying the patient. So how can we be more present as we are already working? So it's difficult to actually add some more responsibilities. What can we be doing? What should we implement in our society?
Great question. And I feel like, we talked at the beginning of this podcast, about your previous work. And I feel like working with a multidisciplinary team. So I'm an oncologist. And while I would love to do everything for all of my patients, I can't do everything. None of us can do everything, right? So having a multidisciplinary team with expertise in different aspects of the care of patients with cancer is absolutely key. So at the Mass General Brigham Cancer Institute, where I do lead our lifestyle medicine program, we have an amazing team. It truly is a team. We have oncology registered dietitians. We have occupational therapists. We have physical therapists. We have social workers, nurse practitioners, nurses, psychologists. Actually, we have a physiatrist, which is a doctor also trained in cancer rehabilitation. So this wonderful team, we meet together every month and we have a clinic for our patients. We do programs, we do webinars, we do all these things. And I think the team approach is really what's needed to provide exceptional care for our patients in collaboration, of course, with their primary doctor and the other specialists, but it really is a team effort, as I'm sure you would agree.
Yeah, for sure. And it's so important to have a multidisciplinary view of the same patient. And as a multidisciplinary team, you can do so much more for them and answer all their needs. So let's dive into lifestyle medicine as a concept. And I wanted to speak with you a little bit about this concept because it's been growing and it kind of has this influencer vibe, I guess. I don't know if you would agree with me. That everyone is talking about lifestyle and how you should implement lifestyle. But this is actually very important in the medical field, like doctors having the proper knowledge in lifestyle interventions and strategies so they can confidently talk to their patients and encourage their patients to do so. So I wanted to see what you think about when we talk about lifestyle medicine in cancer care. What does this truly involve for oncologists?
Um, Love this topic, of course. And so, first of all, I'm sure your listeners know what we mean when we say lifestyle medicine, but interestingly, a lot of people don't even know what that means. So, just to explain, we're thinking about the role of evidence-based lifestyle interventions to treat and prevent chronic diseases, or in the case of oncology, we're thinking about how can we certainly help reduce the risk of additional cancer diagnoses, but also optimize the health and well-being and outcome for an individual with a diagnosis of cancer. So this is so important, and we know that increasing data truly demonstrates the importance of evidence-based lifestyle interventions to help our patients with, again, quality of life and improving outcome. So I think that's why all of us in oncology do need further education. I'm the first to admit, though, I'll tell you, like, I did a lot of medical training to get to this point, and I'm so grateful for it. I learned from the most amazing people at the most amazing hospitals, truly grateful. But did I learn about the importance of exercise for my patients with cancer? Did I learn basic nutrition and how to think about that for an individual with cancer so I could answer their questions about diet after cancer? Did I learn about the importance of helping people manage their stress and the role of mind-body techniques? So all these things I learned kind of after my very intense training. So I do think we need to think about opportunities to help others in the oncology field learn about these evidence-based tools. This is, there's good data. I'm just going to highlight the challenge trial, which was published last year in the New England Journal of Medicine, demonstrating the benefits of an intensive physical activity intervention for individuals with high-risk colon cancer and showing improvements in their outcome. So this is something we all need to be aware of.
Yeah, for sure. And as you said, data says it all because we do have evidence-based scientific data that actually supports lifestyle medicine as a medicine, lifestyle strategies as medicine. I wanted for you to touch on a little bit of each of the pillars of lifestyle medicine for our listeners that are not quite aware of the pillars that exist.
Sure. So I'm happy to. So just because we were talking about, exercise, physical activity, movement, whatever term resonates with you, I will say that there is an abundant amount of data demonstrating that talking to our patients about physical activity, our patients with cancer, is super important. In fact, in the United States, we have the American Society of Clinical Oncology, which is our major oncology organization. And in the guidelines, there's a diet, physical activity, and weight management guideline. It clearly states that individuals going through cancer treatment for curative intent should be counseled about the benefits of physical activity during their treatment because we know that helps people adhere to their treatment. It reduces cancer-related fatigue. It helps manage side effects and so many benefits. We can go on and on. So, and we know longer term that those individuals who are able to adhere to exercise have a lower risk of disease recurrence and improved outcome. And this has been shown certainly in colon cancer, breast cancer, prostate cancer, and research is being done in other cancers as well. So I want to shout it from the rooftops. We need to talk to our patients about exercise. And so what are the basic guidelines? Again, many organizations have come together to recommend, talking to patients about 150 minutes of moderate aerobic activity each week, which of course can be divided up throughout the week, 10 minutes here and there, but really trying to get to 150 minutes. And that could be brisk walking, cycling, jogging, whatever a person loves, and then trying to get in 2 sessions of some type of resistance training each week. And that doesn't mean going to a fancy gym. You can do body weight exercises, find something on YouTube, whatever you like. So that's exercise. I'm sure you do agree that's a really important one. And then, of course, what comes after that, I mean, there's no particular order, but thinking about nutrition. And gee, we know our patients are bombarded with information about diet advice and supplements, on the internet, but really the concept of a plant-forward diet. So much evidence now is showing us the importance of a plant-forward diet with a focus on getting enough fiber in our diet. So important for patients with cancer and so good for the gut microbiome. And there's increasing research in some cancers demonstrating that a healthy and diverse gut microbiome may be associated with an improved response to certain treatments, such as immunotherapy. So plant-forward diet, yes. Of course, cancer comes with immense stress and anxiety. And so thinking about how we can address stress management is so important. And there are many guidelines now. Certainly, there's the Society of Integrative Oncology and again, American Society of Clinical Oncology who have come together to provide guidelines on the importance of mind-body techniques, stress management approaches that are so important for our patients with cancer. So we've done physical activity, nutrition, stress, sleep. Oh boy, we all know sleep is important. Unfortunately, many patients with cancer experience sleep disturbances. And, this is, for so many reasons, we know that if you don't get a good night's sleep, it's hard to function the next day. Our patients are already experiencing cancer-related fatigue. So thinking about strategies to address sleep, whether it is with medications in some instances or using strategies like cognitive behavioral therapy for insomnia or other tools can be so helpful for sleep. And then getting to the last two, thinking about avoiding risky substances. Obviously, we know tobacco use is still the leading lifestyle factor that contributes to cancer risk. So for our patients who are still smoking, we want to work with them to help them address this habit, which I know is very challenging. We also know alcohol, unfortunately, is a risk factor for many different types of cancer. So helping our patients cut back on that is really important. And then finally, last but not least, is social support. And, this is such an important pillar of lifestyle medicine. We know that individuals with cancer who do have social support are going to do better, whatever their diagnosis is. So if a person really is lacking social support, thinking about resources in the community, how can we help them get support to help them get through their treatment is so key. So that was a quick summary of the 6 pillars.
And that's amazing. Thank you. Thank you so much for this clear explanation of the six pillars of lifestyle. That's so interesting to understand how they can be separated, but still all of them are interconnected. And even with this evidence-based support behind this, there's a lot of misconceptions that a lot of patients encounter. I would like for you to tell me what's the top two or three misconceptions that you have heard.
Oh, we could go on and on. We could spend a whole hour talking about this. And this is, our patients are, my patients tell me this every day in clinic. They are bombarded with information about what they should be doing to treat their cancer. And sometimes if it's on Instagram or TikTok or whatever platform you're on, the person who's sharing whatever it is may seem very convincing or may even have a doctor degree listed on their profile, but you have to kind of take a deep dive. So when it comes to supplements, I'm just going to be black and white. There is no supplement that has been shown to help prevent cancer or reduce risk of recurrence. Period. Okay. The American Institute of Cancer Research and the World Cancer Research Fund have come together and stated that very clearly. Are there sometimes a role for certain supplements? Of course. Sometimes there's a role for vitamin D. We know I'm in New England here. Most of us are vitamin D deficient because we don't get enough sun, okay? So yes, vitamin D is an important supplement. Sometimes people do need to take iron if they're iron deficient. So I'm not saying never take a supplement, but when you're being sold something on Instagram that's gonna cure the cancer, save your money. And I have to talk about this every day in my own clinic, by the way. And also, that's number one. Number two, another misconception that is out there. I think the diet misinformation is particularly difficult. There is so much information out there. A lot of my patients are asking me, should I be on a vegan diet? Should I be on a keto diet? What is the right diet? And I think of this figure on the Harvard School of Public Health nutrition site. It's called the Healthy Eating Plate. I love this figure, which hopefully we can link to it, because it shows a plate and half of the plate is fruits and vegetables. A quarter of the plate is a whole grain. Maybe that's brown rice, quinoa, whole wheat pasta, whatever, okay? And then a quarter of the plate is a protein. Maybe it's a plant-based protein, such as legumes or tofu, but maybe it's chicken or fish. We're limiting our red meat, we're avoiding our processed meat. So I'm like, look at this plate. This is what your diet should be. Just keep it simple. We know that plants are so important. Again, thinking about the gut microbiome, thinking about the fiber in our diet, thinking about all the phytonutrients. So those are some of the two top things that I have to talk about all the time, is the supplements and the diet. I'm curious what you would say about that too.
Yeah, well, as occupational therapist, the most misconception is that I'm in pain, so I cannot do exercise, so I cannot go to therapy. So that I think it should be this is that if you have pain, you should still do exercise. You should still go to therapy. I understand it might be difficult, and maybe you also have some fatigue associated, but this is still important, and this will help in the long run. So yeah, thank you so much for sharing yours. And I would like to speak with you about the paving program more specifically. And I love that smile. As I said, paving is like
Yeah, I'm happy to. It's something I'm very proud of. So, as I mentioned a number of years ago at that conference, I met Dr. Beth Frates. She was developing the Paving the Path to Wellness program specifically for stroke survivors, which is amazing. And so I collaborated with her to adapt the program specifically for breast cancer survivors. So the way it started out, a 12-week program based on the pillars of lifestyle medicine that we just discussed, but we also included other important topics, which I alluded to earlier. How do we set goals? How do we think about that concept? What is the role of a timeout or a break, in our day or during our week? How does one's sense of purpose change after a diagnosis of cancer? So there's 12 topics, and we meet each week, and there's a didactic component where we talk about the topic, and I would share the evidence. For example, what is the role of physical activity for a breast cancer survivor? So we share the evidence, And then, of course, in a group setting, we discuss the topic and set goals together and meet each week to really take a deep dive into each of these topics. So I will tell you, the first time I offered this group, which was in 2019 in a conference room at the hospital, at the very end of the program. And by the way, I'm going to be transparent with you. I was scared the first time I ran a group lifestyle medicine program. I had never run a group program with patients before. I'm used to the one-on-one, as a doctor. So I remember the last session, I was like, you did it. I was like congratulating the patients. We did it. We're at the end. Congratulations. And one woman looked at me. Her name is Linda. I love her. She's like, Dr. Comander, we are not done. So these women really bonded over those 12 weeks, learning about each of these topics. They formed these strong social connections. They loved the information. They felt empowered. Now we have the tools for how to move forward after this horrible cancer diagnosis. So those women continued to meet first in that conference room. They got approval from the hospital to meet there. Then COVID happened, so they started meeting on Zoom, and they are still very connected. They call themselves the Originals, and they will tell you that the greatest gift of the PAVING program, yeah, sure, they love learning about the science of exercise and nutrition and stress management and all the stuff that I was so excited to teach as a doctor. But the greatest gift was the social support and the connection from other individuals who truly understood them and helped them with their health-related goals. So I think teaching about lifestyle medicine and providing social support and accountability and building a community is like the most beautiful thing. So I have to tell you one quick thing. So this program's been going on since then. We now have a whole team. I mentioned a multidisciplinary team. I have amazing people who work with me on this program and teach it as well at Mass General. Amazing people. And we fundraise for the program each year. And actually this weekend, we're doing a 5K where people can walk, they can ride their bike, they can kayak, whatever they want to do. And we're raising money for the program. And we got everyone a cute t-shirt, and we've really built an amazing community. So that's what's been so special about this program.
That's amazing. And again, thank you so much for all the work that you have been doing. It's amazing to learn how from one connection in a conference came a whole program that has been going on for 6 years already, right? And even throughout COVID, did you during COVID maintain the program? Did you do it online? Are you still doing it online? How can people access to this?
Such great questions. So yes. So, in March of 2020, all of us had to adapt, right? And so I realized all of my meetings were now going on Zoom. And I was like, okay, I think I need to turn PAVING into a virtual program. So we did. And we started doing that in, the spring of 2020. And I will tell you, I was a little worried. How would it go with a bunch of people on the screen? Honestly, it worked beautifully. People still formed these wonderful connections, even through Zoom. And honestly, we had people join us I'm in Massachusetts, so New Hampshire is north of me, Vermont, Florida. We had people who are Mass General patients joining us from all over, which was really special. So we've actually kept it as a virtual program. Obviously, there's pros and cons. Being in person is so wonderful, but we have kept it that way to reach more patients, make it a little bit easier for people to access it. And you ask a great question. Through our program at Mass General, we have such a long waiting list because every patient with breast cancer wants to do our program. So we limit the program at Mass General to our patients, but along with Dr. Beth Frates and another wonderful colleague, Dr. Michelle Tollefson, and another wonderful colleague, Valeria Tibnan, we have a nonprofit. So it's called pavingwellness.org. And through the nonprofit, we're hoping to offer more of these programs to everyone. And so including for breast cancer patients. So to be determined, but that's something we're working on right now.
That's amazing. I will make sure to link the nonprofit website to this description. Yeah, we cannot see correctly the book, but Yeah, maybe if you put in front of you, right in front
I
of
know.
you.
So
See?
I just want to share.
No.
You're
Okay, yeah,
so
perfect.
amazing. So, my patients during the program is pretty obvious they would benefit from a workbook to help them learn the material as we covered each topic. So last fall, we published this workbook. It's called Paving Your Path Through Breast Cancer and Beyond, Evidence-Based Lifestyle Medicine Tools for Cancer Survivorship. It's in color, so it's fun to read. And basically, it's each chapter focuses on the topics we review in the paving program. It's really written for patients, but honestly, healthcare providers would love it too. And honestly, it's been such a gift to bring this to the world because I've heard from people from all over how it's really benefited them. And so I feel like in this world of misinformation, I can assure you everything here. There's tons of references. You can look everything up yourself. So on PubMed. So anyway, we're really proud of this. So this was a book written with Dr. Beth Frades and Dr. Michelle Tollefson. And all the proceeds go to our nonprofit, by the way. So just happy to share it.
That's amazing. And again, thank you for everything. Congratulations on all your work, and actually also the book, which has amazing reviews. And as you said, everything is evidence-based. So that's really important that we can share information that people can actually believe and learn from. So let's dive into the future of oncology care here. When we step back and look at bigger picture, we can see that oncology is no longer focused only on just treatment itself. So we are also focused on the quality of the survivors. And as we are having many more survivors, which is good because medicine is progressing, so we have more survivors. But it also is important to think about their quality of life. And programs like yours are amazing because we can teach them how to have better quality of life and how to implement the lifestyle strategies that they need to have um, a more balanced lifestyle. So I wanted to ask you, are we actually prepared for this? Are we actually prepared as a system, as a healthcare system, as healthcare professionals, multidisciplinary teams? Are we actually prepared to have so many survivors looking for these interventions, looking for these strategies? And what are still the barriers today that the patients face and healthcare systems cannot respond to them?
Wow. Well, I know we have a lot of work to do. And I'm grateful to meet you and learn about the work that your organization is doing. I mean, I looked this up right before since, I live in Boston, so I know all the data about survivors in the United States, but I looked this up in the world. There are over 53 million cancer survivors. And thankfully, as you noted, this number is growing, thankfully, due to improved early detection, more effective treatments. But wow. So, I mean, we have a lot of people to reach, right? So, are we prepared? Well, I mean, yes and no. I mean, I think, as you stated, there's growing interest and recognition about the importance of these tools, these evidence-based tools to help our patients. But I do think there are a lot of barriers, as I'm sure you would agree. I mean, first of all, just educating oncology healthcare providers about the importance of thinking about lifestyle medicine tools when talking to patients. We are making some progress, but I think we do obviously have work to do in this area. Also, just thinking about certainly in the United States, in our typical visits with patients, there's limited time. There's really not a lot of time to discuss lifestyle factors in a very short clinic visit. And so that is a barrier. Time. So lack of education, time, and of course, reimbursement, right? So we're very much tied, certainly in the US, and I'm sure where you are too, like how do we get reimbursed for these services? For example, the paving program, currently, how do I support that program? Through philanthropy. Again, we're doing our 5K. We're very good at fundraising, I should say. But is that something we should be doing? Should we think of other ways to make it more sustainable? So these are all important questions, and I think we do have a lot of work to do. And it's going to take a lot of us, jumping in and trying to make changes here.
Yeah, for sure. And as you said, is inevitably impossible that you can fit everything. And I'm not quite sure how many minutes you have there for a consultation, but here in Portugal is mostly 15 minutes. I guess if the professional has their own consultation or their own clinic, they can extend the time. But if normal consultations in a normal clinical setting, it's like 15 minutes. So it's not enough to fit everything, of course, and we need to have more space to speak about this with the patients. Well, actually, medical doctors need to have more space, more time to speak about this, not just the knowledge, but even when we speak about this knowledge. So if we go back to study, do oncologists receive enough training on lifestyle strategies?
So, I will say, at the present time in 2026, I still think the answer is no. This is an area I actually am super interested in, and perhaps this is an area I should invest more time in because I am very involved in the American College of Lifestyle Medicine, and I've collaborated with a colleague, Dr. Nigel Brockton, to develop a specific module on lifestyle medicine and cancer for a residency curriculum. So doctors, when they go through residency, if they choose to train in lifestyle medicine, they can do this module to learn about cancer and lifestyle medicine. But is it being offered for a fellow? So in the United States, people then do a fellowship, more specialized training in hematology oncology. That's what I did, a 3-year fellowship after my residency. So I think fellowship would be a great time to find ways to provide more education. So thank you for like raising this issue because I do think if we're really going to make change, we need to find ways to educate the doctors and all the other healthcare professionals who are caring for patients with cancer.
Yeah, for sure. And I'm not just putting the weight on the oncologist. I'm sorry if it felt like that.
It's okay, no.
Actually, I have this question. Maybe I can see your perspective. As survivorship has become a larger part of oncology, who truly owns this field? Who truly owns this phase of care? Is this for the oncologists? Are this for the multidisciplinary team on cancer survivorship? Are are general practitioners or family medical doctors should be more aware of the lifestyle oncology fields? Who belongs? Who is this from?
This is like a very, very good question. And actually, I don't know if I have a right answer for you. I can tell you, though, I am involved in an initiative where hopefully I can do a better job answering this question. So, through the American Cancer Society here in the United States, we do have this. I can send you the information after this program starting in June, which is really a 6-part series, really focused on various topics of cancer survivorship, really directed not so much to oncology healthcare providers, but to primary care doctors, family physicians, social workers, nurses, occupational therapists, physical therapists, all over the United States to really educate all of these team members about these key principles of cancer survivorship. Because I think there is a need for education of everybody, right? And I think that is one step. So I'm really honored to be part of this initiative. And you'll love that I'm speaking about lifestyle medicine for cancer survivorship. So that's my talk, which will be in August. But so that's one strategy. But you're absolutely right. Our primary care doctors, at least in the United States, and I'm sure where you are too, are very overburdened. There are so many things that they have to do their job well, which so I'm grateful for all of them. But taking on survivorship care is increasingly complicated given the treatments we now give and all the potential side effects. So it really should be a collaboration between oncology and primary care, but I do think it is often very challenging. So a work in progress for sure.
Yeah, for sure, and I do believe so. As you said, this is not just for the medical doctors; it's also for the other professionals that are also working as the
Yes.
dietitians, the nutritionists, or the occupational therapists and physical
Yes.
therapists. So everyone else is actually looking for more information. And this is honestly why we created the advanced certificate in lifestyle oncology, so that we can touch in all the different pillars. And also, as it makes sense, the course starts with the basics of cancer, of oncology. So we touch on all the topics regarding the treatment and the symptoms and the side effects, and then we touch the pillars of lifestyle oncology, because we can see that professionals are actively looking for this. They are working, and they are feeling, as you said in the beginning, that you felt like your patients were asking you questions and you were not quite sure how to answer them confidently. So you were looking for answers. You went looking for answers, and you didn't find all the answers. So you are also creating them, which is amazing. And you are creating this beautiful path, and as we want to do so, and in our in our path. So that this is why it's so much needed to have these conversations, to spread the word and to raise awareness about the importance of lifestyle medicine in oncology. And that's also why we have our course. So now I have to ask you about the future. So let's imagine that we are 10 years from now. What do you think our present of 10 years from now would look like?
Ooh, I love this. Well, I hope in 10 years, given your work, my work, everyone else's work who's passionate about this field, that we're all going to be doing a better job providing care for the whole patient, as you stated at the beginning. And I was thinking about this concept recently, since I gave a talk recently focused on this. And there in the United States, the father of modern medicine is this man named Sir William Osler, who is at Johns Hopkins University. And he has this quote that I'd love to share with you. The good physician treats the disease. The great physician treats the patient with the disease. So I feel like that quote really encapsulates how we should think about care for our patients with cancer. We know there are amazing developments in how we treat cancer. I am grateful for all of them, this era of precision medicine. But how can we also treat the whole patient and help them improve how they tolerate their treatment, improve their quality of life? And at the same time, I hope we will be improving their outcomes. So having these tools incorporated into every patient's care, that would be the goal.
It's amazing, and I truly hope for that as well. As personally, I would add, for me as occupational therapy, that in 10 years everyone knows what an occupational therapist is.
Yes, for sure.
But yeah, that's also my personal note. But
Yes.
thank you so much for everything. I would like to, as we are going to the end of our episode, I would like to ask you before we finish, to leave a note for our listeners. What do you think, about lifestyle medicine in oncology? Just a little note.
Right. Well, I know we all have a lot of work to do, as we've discussed, but I also don't want us to feel overwhelmed. So I love this quote from the Chinese philosopher Lao Tzu. The journey of 1,000 miles begins with a single step. So as we think about this concept, how can we all do a better job incorporating these tools into care of our patients with cancer? Just taking that first step, one small change to think about something you can do with your own patients to help them. Maybe it's asking them what they do for exercise and giving a suggestion that they try to walk for 10 minutes each day. Just one thing. Maybe it's adding a serving of vegetables to their diet each day. But just helping people with one step would be an amazing way to move forward. So that's my thought.
Oh, thank you so, so much. It was amazing to have you with us. And this episode is such an important reminder that we need to look at the whole person and support the human being and the family as well. So thank you again for all the work that you have been doing. It's amazing. It was a huge pleasure to have you here in the episode, and for me to be the host of this episode as well. Thank you so much.
Thank you so much. I loved discussing this with you.
And to our listeners, thank you as well for listening to the Oncology Revolution podcast. And if you enjoyed this episode, feel free to share it with your colleagues or anyone who would like to learn more about lifestyle oncology and survivorship care. And see you all in the next episode. Bye.